Namaskar. Myself, Dr. Ankit. I'm working as a consultant in Sharda Hospital in a research center. Here is my colleague, Dr. Manish Bharti. He is a senior consultant in our hospital. He has given me the opportunity to sail along with him, and he has enriched experience in critical care and as well as in bronchoscopy. And he has worked all across the country and Middle East, and he has so much of experience in critical care. So first of all, I would like to thank Sharda Hospital for giving us the opportunity to fly high and achieve our mission. So very soon, and from today, we are going to start an acute bronchoscopy care center in Sharda Hospital. So today we have demonstrated two patients live session in our medical ICU, and I have learned a lot from this bronchoscopy training center. And since 2 years, I am working with Dr. Manish Bharti. And from today's session, I have learned that bronchoscopy can be used as a diagnostic as well as therapeutic tool. So in both the cases, one case it was worked as a diagnosis. Probably we were suspecting some 𝐂𝐸𝐻𝐿 carcinoma, and in second case we found it as a therapeutic tool, so that we have done the source control and in treating the hypoxemia of the patient. So after this, I would like to speak something about this bronchoscopy.
So, namaste, very good afternoon to each one of you who is listening to us. Let me tell you, thank you first of all, Dr. Ankit, for introducing me. And me and Dr. Ankit, Dr. Ramamurthy Sharma, we are working as a core critical care team at Sharda School of Medical Sciences and Research at Sharda University. And this is the first project of its own kind which we have been able to establish in the campus of Sharda University. This is the first center in this country which is going to have skills for the intensivist for acute care bronchoscopy by the intensivist and for the intensivist. That is something which is very unique, Dr. Ankit. Yes. And the reason why we are promulgating this concept is because of the simple fact. We believe that the people who are trained to deal with the sickest of the patient, who are available round the clock, they should not wait for something to get sorted out maybe after a day or maybe after 2 days. So if the patient has an acute problem, it should be sorted out by an acute care physician. And in order to take care of this acute care issues, now we have seen, once we are getting trained in the field of acute care bronchoscopy, we are able to help our patients in reducing their time onto the ventilation. If they're not on ventilator, we can actually, today we have learned, we can actually rationalize and prevent even the intubation in them. Not only this, we have been able to change the antimicrobial practices for this, the hospital. We have seen that how much we have been able to reduce in terms of antimicrobials consumption.
Yes.
All this could have been possible because we are doing something which is evidence-based, which is helping our patients, and which is being done by the people who are experienced enough to handle those sickest of the patients.
Yes, very truly said by Dr. Manish that we are using this bronchoscopy tool for the diagnosis. So as like making the diagnosis or differential diagnosis rather than 1 point, second point, third point, why don't we go inside the lung and see what is going on rather than making differentials कि इसमें क्या हो सकता है, क्या नहीं हो सकता है. तो आज भी जैसे हमने देखा कि इसने हमें बहुत हेल्प किया डायग्नोसिस बनाने के लिए. So rather than making on so much of liberty in seeing the patient, if we have the chance to see the proximal as well as the distal respiratory airways and help us in making the diagnosis.
Very truly said. And let me tell you, Dr. Ankit, I don't want to drive the car which has no visibility. Yes. So let me tell you very frankly, I will only sit in the car where the front screen is visible.
Correct.
So similarly, how can you drive a patient where you don't know where are you heading?
Yes.
So you need to be able to see that what is happening in the patient airway, the tracheobronchial tree, in case if the patient is coming with a respiratory failure. And as we have discussed in the morning, people have a lot of hesitation when it comes to the bronchoscopy. Bronchoscopy is nothing more than the sophisticated suction, where you can actually do everything under the vision.
Correct.
Rather than hitting the tracheobronchial tree, the airway anatomy in a blind way and injure them. Yes. It's better to do everything in a visible format.
Correct.
And why you want to have a privation of your senses where you cannot see anything and you want to treat the patients?
Yes.
I will be very, very unhappy to treat my patients where I don't know what is happening.
Yes, yes, yes.
And it's a 10-second job if you are expert enough. But I do agree with you, Dr. Ankit, it has a learning curve. The learning curve could be steep, especially when you're dealing with the sickest of the patients. But if you are getting trained on day-to-day basis, if you have a good mentors, like today we had Dr. Tushira, Dr. Rajesh Mishra, you yourself is a mentor now.
Yes.
So if you have a good mentors across with us, it's just a matter of time, right? So I think it was a wonderful opportunity for each one of us to witness and to make a difference in the field of acute medicine.
Thank you, Dr. Manish, for sailing along with you. And I have learned a lot from this bronchoscopy procedures. Thanks a lot.
Thank you. Namaste.